Hi, I'm Dr. Anushree Muralidharan and today I'm going to talk about GERD and how to treat it naturally. Please watch the video till the end to know few diet and lifestyle modifications you need to take to manage GERD. So what is GERD? GERD is a digestive disorder that occurs when the acidic content of the stomach, including the food and water we take, will come up in a retrograde motion through esophagus reaching the throat. It may irritate the lining of the esophagus and the throat. It usually occurs in people where the lower esophageal sphincter is weak and relaxes in an abnormal way. So what is a sphincter? Sphincter is a muscular lid-like structure that opens when we take food and closes after the food intake. Everyone may experience GERD or this gastric reflux once or twice, especially when we burp. We feel an acidic, sour taste in our mouth, which is usually accompanied by a heartburn. But when this become quite often or when this occur quite often, then it can be considered severe and is to be understood that it is pathological GER or GERD.
Usually noticed symptoms are sore regurgitation, heartburn or acid indigestion, usually after eating. It worsens while lying down and during night. It may last for about 2 to 3 hours. Patient also experience bitter taste in mouth and chest pain. Pain in chest is due to the acid stimulating the nerves of the area. One other classical symptom is sore throat and a lump-like feeling in throat, due to which patient feel difficulty to swallow. Dental erosion, tooth decay, and other dental problems are also noted. It is due to the acid corroding the enamel of the teeth. Few symptoms of asthma, chronic cough, hoarseness of voice are also seen in a few people.
The diagnosis is by reviewing the symptoms and the medical history of the patient and also by the new investigative techniques. The following investigative techniques are employed nowadays.
Moving on to the diagnostic techniques of GERD. X-ray of esophagus, upper endoscopy, esophageal mobility test, barium swallow radiography, esophageal manometry, gastric emptying studies, esophageal pH monitoring or acid testing are the few diagnostic techniques used nowadays.
Antacids are the usually prescribed medication, but its long-term use may lead to altered calcium metabolism and magnesium buildup in the body. H2 blockers and proton pump inhibitors are also given. In case of poor response, surgery is also done nowadays. Funtoplification or anti-reflux surgery is the most advanced one. In patients with a condition called Barrett's esophagus, as I mentioned before, which is a premalignant condition, periodic endoscopic examination should be done. A small tip to all young Ayurveda physicians over there. According to Ayurveda, the treatment of Ama Jirna, Paitiga Ama Chikitsa, Amla Pitta Chikitsa, and Udavarta Chikitsa can be followed according to the patient's condition. But make sure to do Amapachana and Vadanulomana as well. Aushadas should be specifically Pittahara, Tiktarasa Pradhana, Kledahara, and Ruksha. Mridu Virechana or Purgation and Kshiravasti can also be done according to the patient's condition. Usually taken Kashaya Zar, Amridotara, Pajanamrita, Gulichyati, etc. Avoid Arishta Zanasava. Along with medicines, diet and lifestyle modifications are also important. Let us move on to the diet and lifestyle modifications.
Diet changes in GERD. Try to avoid large meals at a time and chew food thoroughly and eat slowly. Avoid eating late at night and try to have your dinner 2 to 3 hours before going to bed. Avoid eating while traveling. Avoid fried and fatty foods, alcohol and other beverages, chocolates, citrus fruits and fruit juices, spicy food in large amount, caffeinated drinks, tomato and tomato ketchup, garlic and onion, cheese and other dairy products, carbonated drinks, etc. Also, reduce consuming non vegetarian food, especially prawns, which are heavy to digest. Frequent intake of non steroidal anti inflammatory drugs should also be avoided. Too much water or any liquid should not be consumed just after a meal or close to mealtime. Avoid drinking iced water and chilled drinks. Also, make sure not to consume some combinations like alcohol mixed with soda or fruit juices. Certain lifestyle modifications are also to be taken, like smoking should be completely stopped. Head of your bed should be elevated a few inches so that gravity work in reducing the acid reflux, and sleep on your left side. Avoid exercise and yoga poses which involve inversion and headstand. Avoid wearing tight clothes around abdomen, especially tight belts, and start practicing relaxation techniques.
By following a proper diet and lifestyle pattern, the symptoms and sufferings of GERD can be reduced to a larger extent. Friends, please do subscribe to our channel. Daily we will be posting videos on Ayurveda, yoga, diet and lifestyle correction. And here we will be discussing how to get cured of various diseases affecting the mankind through Ayurveda, yoga and diet. We are on a mission to make aware the greatness of Ayurveda through YouTube and other social media platforms. So I request all of you to share this video with your friends and relatives. And please do comment which health issue you want us to discuss. Thank you for listening. This is Dr. Anushree signing out.